Hello, I'm Dr. Tony Oshon, and it's my pleasure to speak to you today about a very important health issue. I want to talk to you about hypertension, but this time I'm talking about hypertension in pregnancy. I will start by telling you a story. This story is about a Nigerian lady named Nancy. She was a young, vibrant, and hardworking woman who was very excited about her pregnancy, second pregnancy for that matter. She went for an antenatal checkup at a local health center and she was told her blood pressure was a little high, but nothing to worry about. This didn't bother her at all because in her first pregnancy, she had similar readings and she delivered them successfully at 10. However, things took a turn for the worse when Nancy's relatives noticed that she had started gaining weight unusually. Her legs were swollen for over a month and she started having an unbearable headache that wouldn't go away. She sought medical attention and was treated for typhoid fever and malaria with over-the-counter medications, but her situation continued to worsen. She started having blood vision, pain in her upper abdomen, and vomiting. She also was passing small volume of urine compared to before. Nancy's relatives became very worried and decided to take her to a nearby cottage hospital. Upon their arrival, the doctors quickly noticed that her marker's blood pressure was very high, and that there was protein in her urine. They suspected she had a preeclampsia, a pregnancy complication that is characterized by high blood pressure and damage to organs such as liver and kidneys. Before they could do anything to help, Nancy's situation deteriorated and she started having convulsion. Sadly, she passed away just 30 minutes later. Now, this story is a very sad one. It's a tragedy, and talks about somebody who didn't take a danger sign, a warning sign seriously. Now, today I'll talk about pregnancy, hypertension in pregnancy. Now, last time in my previous video, I talked about hypertension being blood pressure more than 140/90, and then pregnancy being an important factor that can make somebody to be predisposed to having hypertension. Now, there are different ways somebody could have hypertension in pregnancy and different types in different scenarios. Now, if somebody is previously hypertensive and goes to have a sustained increase in your blood pressure, and then it's just the raise in blood pressure and nothing else until delivery, you could call that chronic hypertension. But there are some persons that they've never been hypertensive before. Usually, there are people who have had a previous history of having raised blood pressure in the past, maybe in their previous pregnancy, or maybe they even have hypertension before the pregnancy, but then they develop hypertension for the first time in their 4 to 5 months of pregnancy. Usually, there's no problem, no symptom, just the high blood pressure. You could call that what we call pregnancy-induced hypertension. Now, there's a particular scenario which is what this story highlighted. That is called preeclampsia. Preeclampsia occurs when your blood pressure is equal to or more than 140/90. Usually, if the doctors check your urine, they will see protein in urine. And then there could be what we call end organ damage. Maybe your kidneys, your liver, or maybe your respiratory system, or maybe your even nervous system could be damaged. Now, everything doesn't just happen at once. Sometimes you to start with the symptoms that Nancy presented. Nancy had a raised blood pressure as an indicator, and then she started having swelling of the legs. You see that you're having swelling of you begin to gain weight unnecessarily. Then gradually you begin to have headache, and then as the headache comes, you begin to have, if it gets worsened, the blood pressure continues to rise and rise. You begin to have blurriness, you can't see properly, and you begin to have pain, usually on the right side of the abdomen, maybe on this lower part of the chest, and then you begin to vomit, and then you can even have reduced urine output. You're not urinating as much as you should, and then over time you begin to have altered sensation. Maybe you not begin to understand yourself anymore, and then after some time begin to have convulsion. The moment you get convulsion, it's no longer a preeclampsia. We now call it eclampsia. And when it happens, and if there's no medical intervention, your case Well, we don't pray so. It may be the case of this Nancy. So, what is there to do in this situation now? This is real. I know one or two of you have heard of this situation whereby somebody had the raised blood pressure. As you come for antenatal care, doctor says, okay, let me check your urine, let me check your blood pressure. Okay, your blood pressure becomes rise. Okay, let's admit him. Let's make sure that we give him drugs that will reduce the blood pressure. Maybe give the patient drugs that will cause the patient not to have convulsion and all that. So this is important. One, you need to attend antenatal care. When once you're pregnant, antenatal care you need to attend when you're like about 12 weeks. This is about 3 months. You begin to attend antenatal care, and then you are faithful to the visits. Not that you come once and you disappear. And you must go to a place whereby people who are there know what they are doing. They are qualified to do what they are doing. If you're living in a locality whereby you have no access to hospital, they can quickly do a blood pressure check. If the blood pressure begins to increase, there's no need to remain there. Oh yeah, carry your things, move, arrange and go to a better hospital, a bigger hospital than that one, so that they will check to avoid untoward consequences. So I hope I've been able to, help somebody with this video. Thank you very much. Thank you.